Hello, my name is Mark Burton. I'm the head of Manchester Learning Disability Partnership, and I'm going to talk a little bit about the Getting a Life project in Manchester, for which I was the lead. This is a project which finished last April and was 3 years long. It was part of a national initiative originating from the Office of Disability Issues with the support of 4 government departments. And in Manchester we were one of the demonstration sites for the project. The project was concerned with trying to improve both the experience of transition to adulthood for young people with significant learning disability, and also improving the outcomes of that process. Hence the name of the project, Getting a Life, because that's what it was really about, enabling young people to get a life full of opportunity and positive experiences, positive roles, and so on. A major part of the project was focusing on paid employment as an outcome and as an attainment which brings all sorts of other benefits in terms of people's self-esteem, in terms of the perception that others have of them, in terms of their inclusion, in terms of their overall well-being. Young people with learning disabilities tend to be disadvantaged very severely in terms of getting access to work, and yet for many years there's been the technology, the know-how available to support them to actually hold down paid employment. And we ran with this in Manchester, as did other pilot sites for Getting a Life. We had some other things that we focused on, which included trying to improve the process of planning for adulthood, and we had this idea of one plan. The idea being that rather than the many assessments and reviews that young people are subject to try and simplify the process and to have one plan that at every episode of review and assessment was started from and finished at. So anybody doing a new review or a new assessment would start from what was already known about the person, rather than people having to tell their story again. And we made some progress on this, trying to use person-centred approaches so that we put the person at the heart of the planning, rather than thinking of it in terms of what service options there were. So the idea being to fit the service supports around the person rather than vice versa. We got a lot of enthusiasm from families and young people, and from a number of professionals to develop this new approach, and particularly in terms of family-led planning, that really took off, as did person-centred reviews in some sectors. We were also concerned to join up the processes which tend to almost like sort of hit a brick wall at age 18. So everything changes at 18, and some families have described this to me as like falling off a cliff. We were concerned that we smoothed that transition, and one way of doing that was to establish a joint transitions team, a transition planning team, where workers worked across the age groups from, in our case, from 16 up to 21, although the intention is to extend that down and up. It was based on social care, so adult social care, children's social care and health at this stage, but potentially it could be extended, and we have had a connections worker working with the team as well. That's in place and has produced some benefits, but we've got further to go, both in terms of extending the number of people that we work with, so it's not just about severe learning disability and physical disability, but other youngsters get the same benefit of joined up planning, and also shifting the team's work from a reactive to a more proactive approach. We were also concerned to establish on the ground some examples of new possibilities. So I talked a bit about employment, and one of the things we've done is put in place some demonstration projects, 2 in particular, Youth Supported Employment Project, which supports young people through a buddying system to do things like Saturday jobs, merry-go-rounds and the like, so that the idea of work, the habit of work, is getting established early on and getting into people's kind of understanding and aspiration, and that of families and the various professionals that surround the person. And the other one, which was rather more ambitious, was Project Search, which again was part of a national initiative where again we were a pilot site, and with Central Manchester Foundation NHS Trust, we established a site where young people do internships. They are then supported in supported employment to try out various different placements, getting classroom-based support and support from a supported employment officer to tailor the jobs around them, and it was very successful. The majority of young people that went through the programme got paid jobs as a result, and now we're developing a further project on the same basis with the City Council. So we'll have two schemes in Manchester, and the one at the Central Manchester Hospitals is being continued. So that's really about establishing on the ground some real demonstrations of what can be possible, some demonstrations of possible future lives for young people. Finally, the other component was getting the voice of young people and their families to be heard better. And we did this in two ways. One was to work with Manchester People First to establish a Young People's Parliament, so focusing very much on young people from schools and colleges particularly, meeting together on a more sort of formalised basis as a parliament to begin to tell people like me really about what they want, about their preferences, about their needs. And likewise with families, we've been keen to involve families. We involve both families and young people in the work of the project, but also established a transition parents group, or supported it in the early years. It's now freestanding, runs itself, and again that does exactly what it's supposed to do, gives, like I said, a hard time in terms of why aren't we quite delivering yet what we said we would and what we're trying to do. So we did a lot, but I'd have to say that there's a long way to go. And one of the things we particularly struggled with was embedding the best practice in the everyday work of the various organisations that were joining together to work together on this. We established a lot of energy, a lot of enthusiasm, some new ways of doing things, but they were really at the point where organisations joined together, and less at the core in terms of the business as usual of those organisations. So that's one of the big things that we do need to do. We've got a lot more to do on commissioning, on making sure that we have the right service options in place before people need them. So that means that when we're doing person-centred planning, then we've got some real options to choose from and to put in place for particular youngsters. There's been some progress on that, both in terms of improved provision for young people that were previously placed outside the city, for example at residential schools, and also in terms of short breaks for young people and their families. And there's been the development of the matching provision to need tool from Children's Services, which will help get much clearer about the kind of college provision in particular and other provision that's needed. And it's also a good model for broader commissioning. We've more to do in terms of, I suppose, what the jargon would call joining up the offers. So that's really about, because there's different legislation, because there are different frameworks of eligibility and so on for children and adults, sometimes there's a disjuncture at the point where people reach 18 and they then find that they're not entitled to some of the things that perhaps they got before, or conversely that adults provide more opportunity of some sorts and more resource in some areas. So how can we again smooth that join and get the offers to join up? There's some more work to do on that, although we've now established since the project from this month a joint resourcing panel between adult services, children's services, so that we're making these expenditure decisions together. So in terms of what getting a life means for the Pathfinder project, it's really about developing from the themes of Getting a Life, building on the learning that we've done there. So in terms of employment being a default option, something we should consider for every young person, and rather than trying to find reasons why somebody might get work, finding reasons that are preventing them getting work and then working around them. Using person-centred approaches and personalised approaches, for example, to resources. Working again to continue strengthening the voice of young people so that it's very much with us all the time as we make decisions as professionals and bureaucrats in the system. And we also need to do much more work to embed the new ways of working in the practices, but also the systems of the organisations that are supporting young people through the process of transition to adulthood. So the idea of the single plan, which we didn't quite manage to deliver through the Getting a Life project, we're going to get another chance to do that through the Pathfinder. And because there's stronger project management support, there's some money that comes with this programme which didn't come with the previous one, there's high level organisational ownership, we've got a really good chance of making a lot of this happen. Again, this isn't easy. It means changing a lot of things, a lot of systems, a lot of organisations, a lot of practices, a lot of cultures. So it does take time and it takes sustained effort, but it is doable. And I wish the project every success.